Should I use a topical retinoid for my acne? That's the question that we're going to discuss today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we're a dermatology practice specializing only in the treatment of acne. And we like to bring you insights from our daily practice so that you can learn from some of our experiences. And we hope that it helps acne sufferers navigate the path toward clear skin. But of course, this is not medical advice, and this is only for educational value. So in today's discussion, I'm going to talk to you about some themes that we're seeing at Advanced Acne Institute over the past few weeks. So we've had quite a few patients come to see us because they've been under treatment for their acne with prescription medicines, but they're not getting better. As a matter of fact, they're getting worse, and they don't understand what's happening. So a common theme that we've seen is that a number of these patients are using various topical retinoids. So a topical retinoid is a cream that is derived from vitamin A. So for example, tretinoin, adapalene, tazarotene, these are all examples of topical retinoids. And they're used quite often by dermatologists who are treating acne. And it's become almost a reflex action. So when a patient goes to see a doctor for acne, reflexively, the doctor often includes a retinoid as one of the mainstays of the topical regimen that is prescribed. And this is because it's recommended by a variety of organizations, and it's something that is commonly used. And a lot of times it's just a reflexive action. The patient comes with acne, they get a topical retinoid plus something else, and we send them off and they come back to see if they're getting better. But the problem is that if you don't look at these things more objectively, sometimes they're not quite always the best option for every patient. And one of the things that can happen when a patient uses a topical retinoid is that their acne can get worse. And it's a potential side effect. It doesn't happen to everybody using a topical retinoid, but it does happen with enough frequency that it is something that needs to be considered. And so in our practice, we've seen a number of patients coming to see us recently having been using a topical retinoid and getting worse. And for example, a common theme is, well, I had acne in one area. For example, I had acne on my forehead and I went to see the doctor and they gave me this medicine and this cream. And I started putting the cream on and they said, just put it everywhere. So I started putting it everywhere. And now I have acne in areas where I never had acne before. And in some of these patients, their acne was actually becoming very significant and very cystic and very inflammatory. So the common theme was they were using one of the different topical retinoids. And so one of the things that we did right away was we had them discontinue those particular treatments, and those patients began to improve just by stopping the use of those topical retinoids that they were using. Now, that's not to say that it's just topical retinoids. I mean, the fact is that any topical medicine or oral medicine that you use for acne can potentially make acne worse. And I've seen that in many patients over the years, that they can be using anything. Could be a topical cream of a different sort, of a different ingredient, or it could be a pill, it could be an antibiotic pill, it could be a different pill, and they have the potential to get worse. But in particular, topical retinoids have a property where we see it more frequently, that patients do have the risk of getting worse. And if not getting worse as far as their acne goes, the dryness and irritation that topical retinoids can typically cause can be a big factor in limiting their usefulness in some patients, because patients tend to stop using them. They don't feel comfortable with the side effects, and they're no longer compliant with the treatment. And so the usefulness is much less when that happens. And in fact, if you actually look at the data and you look at the effectiveness of these medicines, it's not magical. So these medicines are not the magical medicines that sometimes people are led to believe that they are. And I have patients commonly come to the practice saying, well, I heard that using this topical retinoid or that topical retinoid is going to help my acne and it's going to be the thing that's going to make me better. When in fact, if you really look at the data, it's not all that amazing that you have to pin all of your hopes on one of these types of medications, one of these topical retinoids. So the message is that when you're using a topical retinoid or contemplating using a topical retinoid, you have to be considerate of the potential risk of making your skin more irritated, more inflamed, the fact that it can also promote the development of acne in areas where you may not have had it, and it can make the existing areas of acne even worse. And it's not so infrequent that it shouldn't be considered significantly. It is something that we see in the past few weeks. We've been seeing quite a few cases of this phenomenon where just using a topical retinoid has caused acne to explode and made it much worse, and we had to take action and limit the use of these medications in those particular patients so that we can begin to achieve improvement again. So it's something that should be considered when a topical retinoid is contemplated.